An umbilical hernia is a bulge near the belly button. It happens when there's a weakness in the abdominal wall. This allows internal tissues, like fat or intestines, to push through. Symptoms can include a noticeable bulge, especially when coughing or straining. Some people experience discomfort or pain. Others might not have any symptoms at all. Umbilical hernias are common in babies. They often close on their own by age 2. In adults, however, surgery is often recommended. This prevents complications like strangulation, where the protruding tissue loses blood supply. Let's consider a patient, Sarah, a 45-year-old woman. She noticed a small bump near her belly button. It wasn't painful, but it became more prominent when she lifted heavy objects. Concerned, Sarah consulted her doctor. The doctor examined the bulge. He gently pressed on it, feeling for any tenderness or a cough impulse, which is a bulge that gets bigger when coughing. This helps determine the contents and nature of the hernia. To confirm the diagnosis, the doctor ordered an ultrasound. This imaging test uses sound waves to create pictures of the inside of the body. It confirmed the presence of an umbilical hernia. Sarah and her doctor discussed treatment options, ultimately deciding on surgery to repair the hernia. Before surgery, Sarah underwent routine tests. These included blood work and an electrocardiogram, or ECG, to assess her overall health. The doctor also reviewed her medical history and medications. Counseling is a vital part of pre-op preparation. The doctor explained the surgical procedure to Sarah in detail. He addressed her concerns and answered her questions. He also provided clear instructions about fasting before surgery. On the day of surgery, Sarah arrived at the hospital. The nurses confirmed her identity and the procedure. They started an intravenous line to administer fluids and medications. A final check by the anesthesiologist ensured Sarah was ready for the operating room. Section 4. Inside the operating room. A step-by-step guide to umbilical hernia repair. Once Sarah was asleep under general anesthesia, the surgical team prepared the site. They cleaned the area around her belly button with an antiseptic solution. The surgeon then made a small incision, usually curved, below the belly button. Next came the dissection. The surgeon carefully separated the hernia sac, the pouch containing the protruding tissue, from the surrounding tissues. He inspected the contents of the sac to ensure no damage or complications. Depending on the size and type of hernia, the surgeon may perform a herniorrhaphy or a herniaplasty. In a herniorrhaphy, the surgeon sews the weakened abdominal muscles back together, reinforcing them. A herniaplasty involves placing a surgical mesh to provide extra support and prevent recurrence. Section 5. Closing the wound, placing the drain. Final steps in surgery. After repairing the hernia, the surgeon closed the incision. He used sutures, either dissolvable ones under the skin or external ones that would be removed later. The goal is to create a secure and aesthetically pleasing closure. Sometimes a small drain is placed under the skin near the incision. This helps remove excess fluid that can accumulate after surgery, reducing the risk of infection and swelling. The drain is usually removed after a few days. Finally, the surgical team applied a sterile dressing over the incision. This protects the wound from bacteria and helps keep it clean as it heals. Sarah was then transferred to the recovery room, where she gradually woke up under close observation. Section 6. Recovery and beyond. The path to full healing. In the recovery room, nurses monitored Sarah's vital signs, pain levels, and overall well-being. Pain medication helped manage any discomfort. Once she was stable, Sarah was moved to a regular room. Recovery from umbilical hernia surgery is usually quick. Most people can go home the same day or the next morning. The doctor provided Sarah with instructions on wound care, pain management, and activity restrictions. Follow-up appointments allowed the doctor to monitor Sarah's healing progress. He checked the incision for signs of infection and removed the drain, if present. Gradually, Sarah could resume her normal activities. The doctor encouraged her to engage in light exercises to rebuild strength. Full recovery typically takes a few weeks, and Sarah could look forward to a life free from the discomfort and worry of an umbilical hernia.